So are we rolling?
Yep.
Okay, so we're doing our healthcare vlog. This is July 25th, 2018. And as you know, I'm all about costs, how much healthcare costs and how crazy that is. So I want you to imagine that you are in this administration in Washington. I know. But just try that. And you sincerely have a goal of bringing down the cost of healthcare. As the president did repeatedly as a candidate, he promised this as a president-elect, as president. Now, there are things you could do to make healthcare costs less. Thousands of little ways, even without changing any of the basic laws, without getting anything through Congress. This administration is doing none of them. In fact, it's going the other way. A lot of this gets down in the weeds, but let me walk you through some of the picayune little ways the Trump administration is actually jacking up costs. You remember Obamacare? Yes, it's still there. It still exists. It actually does not only get more people covered, in the end it saves the system money. Now, there are these helpers, these organizations that are given funds to hire people to help citizens sign up. The administration has cut the funding to those helpers, so fewer people are going to sign up. Okay, Massachusetts asked the feds for a waiver so that they could have their own Medicaid formulary. And what's that mean? Formulary is a list of drugs that can be used in that program. So this would mean the state could pick which drugs the state would pay for under Medicaid. So if there was more than one drug that would do a particular job, they could refuse to pay for the one that's spectacularly expensive. This would definitely save money. And other states would line up to do it if Massachusetts got a yes. The government said no, gave no reason. Now, recently, the government abruptly stopped paying insurance companies the risk adjustment money that they had coming under Obamacare, billions of dollars. I'll follow this through a bit here. This is not government money, tax money. No, this is money paid from insurance companies to other insurance companies. They're paid to insurance companies that end up with more expensive customers, people with more complex conditions, from insurance companies that ended up with less expensive customers. This is a way to even out the risk. It's a way to give the insurance companies no incentive to avoid customers who would turn out to be expensive. There are three ways built into Obamacare to even out the risk. The Republicans have already managed to get rid of two of them. This is a big reason why rates are already shooting up much more than they have since Obamacare started. The reasons the government gave for stopping these payments was there was a lawsuit filed against them in New Mexico, claiming that the payments were not allocated fairly. Now think about that. Imagine every time the government got sued over something, as soon as the lawsuit was filed, they decided to stop doing that thing. There would be nothing left for the government to do. This is especially true of Obamacare, what they've been suing about since before it was even passed. The government recently said, oh, we were just kidding, restarted the payments. But you know, that doesn't just reset the things to the way they were before. Think about insurance companies. They're built on mitigating risk. That is their oxygen. That is, they have to be able to predict what things are going to cost and how they're going to get paid for it. The less predictable that future is, the more they have to raise the rates to cover all possibilities. They have to build the risk into their rates. And what the government has said, in effect, the insurance companies is, we will be unreliable. We will jack you around. So this change and its snapback together have raised the risks permanently, which means they have raised the rates permanently. Similarly, let's talk about drugs. The president has been beating up on big pharma and drug prices, going so far as to state definitely that we would see big price drops soon, fast, in weeks. Didn't happen because there was nothing behind it. Samson slayed thousands with the jawbone of an ass. But this jawboning, not so much. What's happened instead is that we are seeing shortages of essential major drugs, especially painkillers, along with calls for more price hikes to give the manufacturers more incentive. Poor manufacturers. Did that help? Didn't help. So, then they turn around and say, Health and Human Services Secretary Alex Azar said this the other day, that he was forming a task force to look into allowing the mass importation of drugs. Think about that. In other words, we find ourselves powerless to beat down the price of drugs in this country, but prices in Canada look a lot better. Can we just go buy the same drugs over there? Great idea. Would destroy the pharma industry's lock on most of these huge U.S. prices. Oh, and by the way, would likely cause big pharma to normalize prices around the world, charging people in Canada and India, Brazil, far more, because the U.S. will end up paying less. That's why it's just a task force asking the question, and we can take bets on whether and when we will see it come up for air. Oh, the list goes on and on. It's not accidental. All of the people who are in charge of these things are actually really smart people. They are veterans of the inner workings of healthcare and healthcare markets. No, these actions are purposeful. And they add up to the administration is actually not interested in lowering the cost of healthcare. We can tell by what they do. For whatever reason, they want to make it worse, more difficult, more unfair, more expensive, step by step, line by line. And that's the way it is in the world of healthcare, July 25th, 2018.